Hiding in each and every one of our necks is a butterfly-shaped organ, the thyroid. The thyroid is responsible for our metabolism, body temperature, energy levels, and more within our bodies. These butterflies and those with Graves' disease flap their wings a little too hard. We call this a hyperactive thyroid. Symptoms include unwanted weight loss, trembling hands, bulging eyes, excessive sweating, a visibly enlarged thyroid gland, tiredness, and trouble sleeping. Graves' disease affects 1 in every 200 people and is 7 times more likely to occur in women than in men. Graves can affect the ability of a woman to get pregnant and cause problems during pregnancy and even affect the unborn baby's development. If left untreated, Graves can worsen after delivery and in some cases can be fatal. Symptoms of Graves can be treated, but no one should have to live with this disease. G-Dex, unlike other forms of treatment, will target the underlying cause of the disease and ensure a return to a well-balanced life. Do not take G-Dex for other thyroid-related problems and ask your doctor if G-Dex is right for you. Tame your butterfly so you can soar. With Graves' disease, the cause of hyperthyroidism is the immune system producing antibodies known as thyroid-stimulating immunoglobulins, or TSIs. These autoantibodies target and bind to thyroid cell receptors, which act as an intermediate between thyroid-stimulating hormones and the thyroid gland. These hormones are what normally is responsible for prompting thyroid cell growth and hormone release. Because of this, when the TSI autoantibodies bind to the receptors, they mimic the behavior of the thyroid-stimulating hormones, leading to additional signals being sent to the thyroid gland to produce excess thyroid hormones and proliferate unnecessary cell growth independent from the body's normal function. Current treatments targeted at Graves' patients consist of treating the symptoms that correspond to having a hyperactive thyroid but do not treat the core of the disease. These treatments include radioactive iodine treatment, anti-thyroid medications, and surgery to remove the thyroid gland. Radioactive iodine treatment works by destroying thyroid tissue cells, successfully lowering thyroid hormone levels, but patients run the risk of developing hypothyroidism. In the case of surgery, hypothyroidism is almost always an outcome and puts patients at a high risk for complications. Finally, the most commonly used treatment, anti-thyroid drugs, often are successful in alleviating symptoms by ceasing the thyroid from producing T3 and T4 hormones, but these drugs usually have to be taken continuously throughout a lifetime. Unlike other treatments, G-Dex will target the underlying cause of Graves' disease, which is the TSI autoantibodies' ability to bind to the thyroid cell receptors and the success of the signal sent to the thyroid. TSI autoantibodies are immunoglobulin G antibodies and are created and released by plasma B cells and have 2 antigen binding sites. However, these antibodies need helper T cells in order for their signal to be transmitted. If something goes wrong in the process of the antibody binding to the antigen-presenting cell, or with the addition of the helper T cell, the T cell will not become an effector and no signal will be successfully sent. Once the T cell is bonded to the antigen-presenting cell, it activates an adhesion protein called LFA1, which allows the T cells to stay on the antigen-presenting cell long enough for it to be activated. G-Dex contains a protein that blocks LFA1 protein from reaching these T cells, which will destroy the immune response of the autoantibodies, and the only response that will reach the thyroid gland will be from the thyroid-stimulating hormones, which will return regular bodily function.